Did the Food and Drug Administration, FDA, pass new laws and regulations to ban sea moss in November 2022? No, that's not true. The FDA does not have the legal authority to either propose or approve legislation, including bans. As a regulatory authority, its role is to enforce laws enacted by Congress. Furthermore, the social media post in question prompted followers to buy sea moss products before the supposed ban. This suggests that the post is a scam to boost sales. The claim appeared in a video posted on TikTok on October 31, 2022. A screenshot of the TikTok video was then shared on Instagram on November 1, 2022. The screenshot claims that the FDA is banning sea moss. The image's text overlay reads, quote, "In November 2022, the FDA will be passing new laws and regulations restricting the use of selling natural herbs including sea moss gel, a known superfood with 92 minerals necessary for human hormone and endocrine function. You can find wildcrafted, untampered sea moss in the profile link, before they ban it permanently." End quote. Here is how the post appeared at the time of this fact-check's writing. Source: TikTok screenshot taken Friday, November 4, 21 hours 31 minutes and 14 seconds 2022 UTC. The account holder who posted the original video, at Dr. Truth Products, included a link in his or her TikTok profile that leads to an online store, selling Dr. Truth Sea Moss Bundle, with elderberry, for $29.99, which was said to be discounted from $79.99. This suggests that, at its core, these claims were meant as a scaremongering tactic to boost sales of a particular product. As of this writing, there is no proposed or pending legislation in either the 2021-22 congressional record or legislative record about sea moss. In an email to Lead Stories on November 4, 2022, an FDA spokesperson declined to comment on the matter. As provided under the Federal Food, Drug, and Cosmetic Act, the FDA does not hold the legal authority to pass legislation, but instead acts as a regulatory agency to enforce laws enacted by Congress. This includes the regulation of food, drugs, cosmetics, biologics, medical products and tobacco, that, when deemed safe, are given FDA approval. Among the measures passed by Congress and enforced by the FDA are those that impose labeling restrictions, not outright bans. These restrictions address unapproved new drugs. Drugs must be sold for the purposes for which they were approved. Section 355, Federal Food, Drug and Cosmetic Act. Misbranded drugs. Drugs cannot feature false labeling or present misleading information in any particular. Section 502, Federal Food, Drug and Cosmetic Act. False or misleading labeling. A drug or device is considered misbranded if its labeling proves false or misleading in any particular. Section 502A, Federal Food, Drug and Cosmetic Act. The FDA flagged 2 products containing sea moss for mislabeling. Both of these products predate the social media claims that circulated in November 2022. As of the date of this fact-check, a Google search for sea moss reveals a host of products available for sale online. On May 24, 2021, the FDA's Center for Food Safety and Applied Nutrition issued a warning letter to Everything Health LLC regarding the sale of sea moss as part of the company's Corona Box, a product box falsely advertised as intended to mitigate, prevent, treat, diagnose, or cure COVID-19 in people. A year prior, on July 9, 2020, the New York-based company Sundial Herbal Products issued a recall letter for misbranded dietary supplements, one of which contained sea moss, Irish moss. At the time, the company said, quote, "The recalled drug products are misbranded and deemed unapproved drugs based on labeling claims which could result in a delay of appropriate treatment by a healthcare provider. Because these products are unapproved, their safety and efficacy have not been established." End quote. The above product, sea moss, Irish moss, is also included in the FDA's Health Fraud Product Database, a list of products that the agency has not approved and claims have committed health fraud. The FDA defines this violation as, quote, "the deceptive promotion, advertising, distribution, or sale of a product represented as being effective to prevent, diagnose, treat, cure or lessen an illness or condition, or provide another beneficial effect on health, but that has not been scientifically proven safe and effective for such purposes. End quote. While it is true that the two products above have been flagged by the FDA for mislabeling, it is false that the agency will ban CMOS in general. Lead Stories sent a follow-up email to the agency to confirm whether there is currently in place, or expected to be, any effort by the FDA to limit access to products containing CMOS.